Welcome to the Cardiac Family Channel. Ladies and gentlemen, do you know that a cardiac test called 2D echocardiography is replacing the stethoscope of doctors, and it is called today as the modern stethoscope. Hey, this is Dr. Avinash Inamdar. I am a cardiac surgeon, and in front of me you have Dr. Sonali. She is an interventional cardiologist, my daughter. And on my right, you have Dr. Sanjeevani, who is not only just a cardiac intensivist, cardiac anesthesiologist, but a highly experienced echocardiologist. I remember we have been doing echocardiography for last so many years. For the last 20, 30 years, you have been doing my echoes, especially the transesophageal echocardiography, and an equal number of transthoracic echocardiography. So about 5,000 of each. So that's our experience. So today we will be having a free flow, unedited discussion on this topic, that 2D echocardiography is the modern stethoscope of the 21st century. So let's hit the topic. So I have one very important question first. The people want to know what exactly is 2D echocardiography. So Nali, can you just explain to the audience?
So it is just simply the sonography of the heart, just ultrasonography of the heart. Just like you do a USG, that is ultrasonogram of the abdomen, or during pregnancy you do ultrasounds of pregnant women. Sometimes you even do fetal assessment of every individual organ. So similarly, we have echocardiography, which deals with studying everything about the heart. So that is in short 2D echo, where we can see the structure, function, and all those details.
A very important investigation in the field of cardiology and cardiac sciences, isn't it?
Absolutely.
Yeah. Now, Sanjeevani, can you tell me what exactly are the indications of doing 2D echography? In what patients would you perform 2D echocardiography, and why are we discussing and saying today, where all over the world it is being said that 2D echocardiography is replacing the stethoscope of the cardiologist? So what is your opinion?
Yes, actually this is a very strange question, because wouldn't you like to test the organ, singular organ, which is giving you life and working for 24/7.
Yes.
You look after your house, you look after your clothes, you look after your makeup, you look after your many other things, but you don't look into your heart, which is only organ which is maintaining your breath, So it has to be done, and there are many instances, many times it has happened that while doing any surgery, certain hole in the heart is diagnosed.
Certain surprises.
These are certain surprises, and sometimes patient may become very serious. And by just simple 2D echocardiography, one can diagnose it, treat it, and patient can have his life almost normal if the condition is not serious. Another thing, during pregnancy or delivery, there are surprises. So this is another paradox, that the baby is screened so many times in fetus, during pregnancy, but the lady who is going to bear that weight for more than 9 months, her heart, whether it is capable of handling this situation, is not examined at all.
I agree with you, because today, as a routine, 2D echocardiography is not performed on all pregnant women, and they are referred for echocardiography only if there is a hypertension in the pregnant lady, or there is some cardiac disorder which is probably diagnosed before, and only in specialized situations. I would agree with you, that 2D echo should be done in everybody. Would it be right in saying that 2D echocardiography should be done in every person who has a heart?
Yes.
Unless they are very heartless.
Unless they are heartless. And one has to do it, and it's a simple procedure that I think...
Previously, while you used to go to a doctor would put a stethoscope here for every patient.
Right.
And he would listen to the heartbeats. Now that has been replaced by a 2D echocardiography.
Would you call it replace, or would you just say supplement?
Well,
I would say supplement, because there are
stethoscope is good to know the lungs, the air entry, any pulmonary problems, but when it comes to the heart,
many things are missed. I agree. Many things are missed.
But why not? You can also get an idea about the pulmonary status, about the fluid.
You can do a lung ultrasound.
You can do a lung ultrasound. And I believe in the Western countries it is happening now. Well, in our country, you cannot make a broad statement like that, because you understand why? Because these echocardio machines are not available on a portable basis with every doctor. Now, I saw so many cardiologists in the Western countries have a portable echocardiography machine, which they just put it to every patient that enters into a cardiology chamber.
But the reason is, today in India, because of the sex determination and the very strong legality behind it, we are not allowed to carry a machine around everywhere. So there are strict rules about it.
You need those huge machines and the inspector coming every month checking so many things.
But that's an important social issue that we have.
Yes,
but I would like to say that though it is started replacing stethoscope, one should not replace it at all, because there are many signs which are beautifully, you can correlate, medical students can learn, you can always confirm.
Because clinical medicine is an art in itself.
Yes, it's an art, and it's very interesting. So one should not replace it, it should be supplemented.
Yes. I agree with supplement, but the amount of information that you get is enormous.
It's incomparable to the clinical information.
Actually peep into
so
the
when it
heart
comes to information, Sonali, what is the information that you gather with this test?
So you get information regarding the structure, first of all. So you understand the muscle status of all the 4 chambers, essentially. You understand the status of all the 4 valves. You know the pressures inside the chambers of the heart, both on the left and the right side. You come to know the status of the great vessels, that is the aorta and the pulmonary artery. So there's a lot of, and you come to know if there's any fluid around the heart. What is the status of hydration in that patient? Is he or she having a lot of fluid, or is the person dehydrated? Especially now that we are facing pandemic after pandemic of different infections, we need to know what is the hydration status. So all these things are, so you come to know the structure and the function and the pressures. So it's a dynamic echocardiogram.
Especially in congenital hearts, like there are certain lesions which are asymptomatic, and then there are surprises. So you have asymptomatic aortic stenosis. So many we have diagnosed. And there are certain indications, contraindications for these people. Like, people going for, say,
a dental checkup. We had that patient the other day.
Or people going for those particular Ayurvedic therapies where they are put in a hot chamber and there is severe vasodilatation. And if there is a moderate aortic stenosis which is missed, because asymptomatic patients are
moderate or even severe for that matter.
And they can suddenly fibrillate. Well, that has happened in some patients in my practice.
Or in cases of pregnancy where obstruction of the mitral valve, that is mitral stenosis, is picked up only during that time because the patient is symptomatic.
So in short, can we say that this 2D echocardiography gives us information about the status of the heart, to diagnose certain diseases, and also it is helping us in the management of the patient, and also to understand the prognosis of the patient and whether there is a progress. You do it serially, you do it now, you do it after 6 months, and you find that contractility is improved.
The functioning of the heart, that is the ejection fraction.
The pressures in the certain chambers have come down, and so many things.
So you come to know whether your treatment is going in the right direction or not.
For example, you have a patient of heart failure, that patient's ejection fraction, that is the contraction, is going to be low. So we have to titrate our medicines according to that function and whether he or she is responding to the treatment that we are providing.
Very true. So,
unfortunately, in our country, you advise a test like 2D echocardiography, people will think 100 times. Why is it really necessary? Why is the doctor asking for so many investigation? Would it help the doctor or help me? Because I have no symptoms, why should I get it done? Then that is the problem.
I think for this, the literacy about the medicine should increase in the society at large.
Yes, and that is precisely the aim of our channel.
With this Google and other things available easily, people should read about it, and then they should come and ask us, please, doctor, please do our echo.
And we have such patients coming to us.
Moment will come, I would be very happy.
No, we do have. We have a lot of
people watching this channel. I'm sure they are going to get educated with this, and that is precisely the prime aim of starting this channel. Okay, now coming to Sanjeevani, I would like to ask you, what would be the time required? People say, well, someone did the echo in half a minute, someone says it took 20 minutes. So what is your opinion on that? Yeah.
See, one has to understand that echocardiography is sort of, it is an investigation which is not based on only medical knowledge. It is, there are so many things like machine, you have to understand the quality of the machine, quality of the machine, knobology. Then one has to understand physics, then mathematics, then physiology, then then comes your medicine, and then is cardiology. So it's not that simple. So echo done in 1 minute, I don't think it is.
I mean, people must be skipping certain views. You certainly take multiple views. You do miss certain findings.
And there are at least 20 to 25 parameters which are understood with this 2D echocardiography, and it gives tremendous information to the treating physician or cardiologist. So one has to do it thoroughly and with all the views.
How much time would you give now?
I would give 10 to 15 minutes. If the case is complicated, you can,
You would take, I have seen you taking 20-25 minutes and giving all the detailed parameters.
For example, I would tell you, in case of aortic stenosis,
that is time consuming.
Which is a stenosis or a obstruction to a major valve which is in the aorta, that is our biggest artery which supplies blood all over the body, and that is difficult to assess by 2D because we are keeping the probe on chest and assessing the structure which is far inside, and because of its anatomical position it is very difficult to capture it. So one has to spend time with adequate knowledge of anatomy and knobology and physics, and then apply. And if you don't properly take the gradient of that valve, you cannot treat this patient simply because if he is mild aortic stenosis, you have to just observe. But if he is severe, one has to address it.
I know there are very complex formulae there, but I think with the invasion of artificial intelligence coming in, it is going to make your life much easier, and the time required will come down gradually.
But it all depends. I was just making the point about body habitus. Now there are people of all shapes and sizes. Now if you have a case of aortic stenosis, for example, and it's somebody who has emphysematous lungs, for example, so the lungs are overinflated, you're not able to get a good echo window, then you have to struggle in the limited windows that you get. Or somebody who's very obese or even very thin, it is difficult to get it. So even artificial intelligence may not help.
To add to Sonali's statement, I would say that when she said emphysema, so one has to know how then this heart is addressed. So you have to go to subcostal view and then see the heart. So unless you practice all these view again and again, then you are not an expert in that. When the time comes that only that view is accessible.
So in short, we could say that the time required depends upon the quality of the machine, the status of the person on whom you are doing an echocardiography, and the competence of the person who is doing it, the echocardiologist. Well, these are the factors which will decide the time
and the complexity of the disease,
the complexity and the dedication of the person who is doing it.
You can get how much ever information.
Now there are so many questions these people come up with. Doctor, is this test safe enough? Are there any hazards of doing these tests, or is it safe enough to do it in a state of pregnancy?
Absolutely. I mean, there is no radiation, there are no injections, you are not injecting anything which is hazardous. It's a non-invasive test, and you can do it repeatedly because the heart is a dynamic structure. Diseases can be dynamic, so it is absolutely safe.
I know. And is it safe for the operator, the person?
Of course, unless of course the operator doesn't stand up and stretch once in a while. Otherwise, you you keep doing.
I remember, Sonali, when you were doing your DM cardiology at the Trivandrum at the Sri Chitra Institute. Once when I called you up, you said, Baba, I am doing the 75th echo of the day today, and I am posted in the echocardiology department, and it's been last 8 hours I have been doing it.
Right.
All complex congenitals and all varieties.
Valvulars,
And
post-operative cases.
When I tell this to people, they always ask, is it safe?
Of course it is safe. It's absolutely safe.
Now, one question, Sanjeevani, what should be the cost for this test? Cost is a very important point today. People expect everything free or as the lowest cost as possible. What would you define the cost?
Actually, it all depends on who is doing it and which machine you use. That's very important, right, because it costs from 20 lakhs or even 15 lakhs to 1 crore. 1 crore.
That's the cost of the machine. You are saying.
This is the cost of the machine.
What should be the cost?
And experience of the person. That is also equally important, because the inexperienced person may miss the diagnosis simply.
What are the range of figures would you say?
It should be around 3,000 to 3,500.
Yes, that is enough. That is what minimum in certain charitable institutions.
I mean, it is very difficult to label these type of things, but one has to.
Yes.
So the range is around that.
It's all around 1,500 rupees to 3,500. Right. It ranges depending upon the operator, depending upon the machine, depending upon the time given for that
hospital or the institute.
Here I would like to say something like I always tell patients that when you go to mall, any mall, you easily spend around 10, 15,000, 6,000, 7,000. That time you don't think of this. But when it comes to your own health and looking into your own heart, which is a singular organ, so you should not think of...
psychologically there is fear, right? Patients or people generally don't want, are afraid of knowing what might be revealed. There is psychology at play.
Fear about facing the facts of life.
That is very
true. And when you go shopping, it's all feel good. I mean, you're not going to...
Very true. Very
I agree. But one doctor has to make it interesting.
Correct.
That echocardiologist should talk to patients. Educate him in this manner, in this topic, and then I don't think he will feel that day we would be happy on that day that patient will come to us.
But that is happening
and that is happening today.
I know so many patients are wanting you to do it.
We are happy actually that they are coming. And for the audience I am telling this, it is not only in urban population, but even rural patients are calling me, madam, I want to get our echo done. Now it is the high time.
I really appreciate your patience in doing it, because I have seen so many other cardiologists, just doing, because they are all interested in stents. But
that's a different topic.
That's something not to discuss
here. That we will tackle later.
Now, can we? What is stress echocardiography?
Stress echo.
I think we should deal it later on.
That's another different topic.
Yes, it's a big topic by itself.
And I think society must be, they should know about it thoroughly.
We will have a separate session on stress echocardiography and also on transesophageal echocardiography as we go on. So, ladies and gentlemen, a short session to understand what is 2D echocardiography. The take-home message is, it's a very safe investigation. It should be done on a regular basis. If you have never ever had an echo done because you had no symptoms, don't be under impression that your heart is normal. Get your 2D echo test done, and it's not something very difficult. There are so many places people are doing. Select the right institution, a right person, and you will get the best results. So, ladies and gentlemen, see you soon in the next video. Until then, thank you very much and a hearty goodbye.